I love my nursing staff. They're the reason I'm able to sleep at night.
We have the quality caring model as our formal nursing philosophy that we use here. We try very hard to blend that high quality technical nursing care with that feeling of well-being and nurturing so that our patients are not only receiving great care, but they feel that they're being cared for.
Nursing team here in Lowell General I work with, they are very compassionate and they are very professional.
We care for members of our community at their most joyful at times and at times most difficult circumstances, with death of a family member, injury to a child, whatever the case may be. And it's very important that we allow ourselves an opportunity to learn from those experiences and debrief from them as well. We have a very formal trauma intervention support group where staff support staff in processing those types of situations. So we take care of the patient and family in the moment, and then we as quickly as possible gather to debrief and take care of each other and make sure that we have the support we need in dealing with those situations.
We have the equipment we need, we have the staffing we need, and we have the support we need to do our jobs.
I think the nurses that work at Lowell General Hospital enjoy working here because they have a passion for community hospital nursing in an environment that has access to wonderful technology and resources, and where they're empowered to have a voice in their nursing practice.
Well, I think our CNO, Amy, is a very inspiring leader.
When the CNO position became available, of course, it was really a dream job for me, and you're never quite confident that everyone would feel that same way. So I quietly talked to some of my nursing colleagues who I have a lot of respect for to get their input, and I was really taken aback by the level of support that I received.
When I started working here, Amy was a staff nurse just like me. So when she became our CNO, I was very proud to see one of us taking a position like that.
She spends a lot of time on the units. She's not afraid to roll up her sleeves and get in there on a busy day and do whatever it takes to get the job done. I think she has a tremendous amount of empathy for her employees, and that empathy is rewarded with lots of support in return.
I think everybody campaigned for Amy because being a nurse in the hospital, being with the patients, seeing that the patients came first, just her working relationship with staff, I think everybody thought it was a really good fit.
She definitely believes in giving outstanding care, and that is something that we look up to as a person, as a nurse, as a human being.
The shared governance model is one that gives nurses autonomy in their practice and brings management level decisions right down to the bedside. So the traditional hierarchical structure of management really goes away, and nurses at the bedside are empowered to participate in decision making around their practice and the care we provide their patients.
I feel we're, to a large extent, empowered to be more or less independent in our patient care, to use our discretion in taking care of those patients.
Shared governance has come into effect in the last 5 years, empowering nurses to have so much more of a say in their patient care delivery and how things are staffed on the floor. The nurses have a voice.
I feel like I can more involved to all those policy changes and how they running the hospital. So it's not just they doing it, we all doing it.
I think there's many reasons why communication across all levels is vitally important. It's important for a sense of belonging and commitment and awareness of what's going on in the organization. It's also important because we do complicated work that changes, and there's lots of updates in practice that need to be disseminated across all levels on a regular basis.
Nursing leadership has set up all kinds of forms of communication now that we use, and we use them every day. The biggest thing I think that they changed was the email. Through our employee email, you're updated right away on things that are changes, whether they're good or bad, that are going on in the hospital. We have the Lowell General intranet, and on the intranet you can find anything that you want, whether it's policies, medications. Everything is just at the click of your hand so that you can find it, so that we're not searching anymore. And it really makes it a nice and an easy way for us to know what's going on.
We use many vehicles to communicate across our workforce. It's a 24/7 workforce of individuals that work, some very part-time and per diem. So in order to reach them, we'll really do whatever it takes to communicate our message effectively. We have a lot of formal vehicles, such as our Heartbeat, which is our hospital newsletter. We have our Daily 10, which is our daily messaging to staff. There are many, many formal and informal avenues we use to make sure the message gets out.
Amy does have an open door policy, and I think that just means that she's willing to talk to any one of us at any time.
I think it's so important to staff satisfaction and quality patient care that staff know that they can communicate any question, comment, or concern to any nurse leader, and myself in particular. It's very important to me to make sure that I'm aware of what's going on in the organization at all levels, and I think the best way to do that is to be approachable and accessible and make sure that people feel very comfortable, not just with the good news, but with the difficult conversations as well.
If you have an issue, you can just walk up to her and say, or shoot her an email and say, Amy, I have to talk to you. And you can come in, and it makes you feel that you're supported, not only by your immediate managers, but by your CNO.
Converted to our electronic record in 2007, and since that time we've worked very closely with our nursing staff to make sure that we're leveraging as much power out of the record for them as we can. So what I mean by that is looking at enhancing workflow, making changes based on their recommendations to make the electronic record more user-friendly, drive practice. We've also made some very specific enhancements to drive practice and help our compliance with very specific quality measures, and that's been hugely successful.
When we transitioned to the electronic medical records, we went from, instead of writing everything down, doing the history and having everything in a paper chat, now everything is on the computer.
Our medexes are online, our orders are online, everything is, and it makes for a safer system because you don't have the errors or the loss that we had before.
We're very proud of the technological advances we've been able to make and the breadth and scope of services we bring to this community, but more importantly than all of the technology is the human element that brings it to life for our patients. So bridging that gap between the Da Vinci robot and the CT simulator and the Heart and Vascular Center and the patient is our staff, and that's what's most important. Many of our formal recognition programs of our nursing staff are very public, and it's important for us to show off and showcase the work of our incredible staff. We have the Wall of Nursing, which is outside the main corridor to administration, that highlights a group of nurses on a rotating basis. Those pictures are updated and changed. And what's so special about the staff on the Wall of Nursing is that they're all peer nominations. So peers have nominated staff that are exceptionally dedicated to the work they do and have distinguished themselves in a particular way. We also have on a regular basis nursing teas, where the nurses who are presented on the Wall of Nursing are celebrated when there's a change in the membership of the Wall of Nursing. We have a tea to celebrate that, as well as to share stories and updates on what's happening on the unit-based councils and make sure that people have an informal setting to share stories and talk about and celebrate the work that we do.
Nurses Weeks allow us to celebrate and feel that nursing has come a long way in terms of advancement, in terms of technical input, in terms of in academics too. We find that, and that goes a long way to challenge and strengthen us to do more, to go forward in our practices.
Nurses Week is a huge celebration for us around here. We extend actually beyond the confines of the particular week, which is in early May, and have celebrations that have a different focus every day of the week. My particular favorite event is the Nursing Excellence Awards Night, where I have an opportunity to formally thank and reward nurses who have distinguished themselves in a particular way over the course of the year.
It's the nurses submitting who's the best. And it goes to a committee and they choose, but the bottom line is it comes from the staff. We submit our candidates, and whoever gets chosen, it's because we chose her. And it's one of the ways that the hospital also demonstrate how much they care about and how important we are to them.
We dedicate a tremendous amount of time, energy, and our budget to ensuring that people know what to do and have the tools necessary to do it.
Within here, there's a lot of support for our certifications. There's financial support for our certification, as well as tremendous support from our managers for anything that we may need, whether it's literature or, you know, is there something that you need to, that would make it easier for you to achieve that certification. So there's a lot of support for that. Within the hospital, we have an entire development department within the nursing department and nursing education. So they routinely put together things that they think will make us better nurses and more well-rounded.
In order to participate in the clinical advancement program, nurses need to complete a portfolio, and there is a very structured process and guidelines for doing so. We have classes on how to create certain parts of the portfolio. We make sure that volunteer opportunities are readily accessible to our nurses so they can participate in volunteer hours that contribute to the portfolio, and it's a very nice way that nurses can advance themselves professionally.
Patients first in everything we do is our mission statement, but it's more than that. It's really what the nurses here live by. And you can see it. You can see it in our hallways. You can see it in the ER, in the OR, when we greet patients, when we greet families. It's all about the patients. That's what healthcare is, and that's really what we do.
As a nurse in the role of Chief Nursing Officer, I feel a tremendous sense of responsibility to make sure that I'm offering our nurses the best environment, the best resources, the best structure that I can in order for them to do their difficult and challenging work. So I think that that is my greatest joy and my greatest challenge as the Chief Nursing Officer, is to be sure that I am using the gifts and resources I've been given and make sure that I'm making those as available as possible to our nursing workforce.